Hello, hello. Are you all ready? So I'll wait till everybody comes back in. How's everybody feeling? Somebody said cold. Full. Tired? How many people are tired? Tired? You came in tired? Yes, that's right. Fatigue is the most common symptom with myelodysplastic syndrome. So my name is Sara Tinsley. I'm a nurse practitioner at Moffitt Cancer Center. I've been there since I was practically born. About 20 years I've been there. And I'm going to talk to you about quality of life. And so we can start. I like to have back and forth discussion. So if some brave soul at this table would tell me what you think quality of life is. What does that term mean to you? Being able to do what you want to do and enjoy doing it, right? Not being too tired to enjoy it, right? How about this table? What's quality?
What you want to do independently.
Independence. That comes up a lot. Not having to depend on other people and impact their routines, but do it when you're ready to do it. Right? Anybody else at that table? No. What about this table?
Being able to continue playing golf.
Playing golf, yes.
And feeling well.
And feeling well, yes. I have one patient that I see, and I ask him how many times he played golf since I saw him the last time, and that's how I know how he's doing. Okay, anybody at the back table? What's quality of life mean to you?
Lasting the full 18 holes.
Lasting, walking them or riding? Either way.
Showing up and finishing.
Mine would be a little different. I'm just trying to enjoy every moment.
Enjoying every moment.
And the small things are not going to bother me. Just have a wonderful time.
Not to sweat the small stuff. Just try to enjoy the moment. That's very good. Anybody else? Yes.
Quality of life for us is being hopeful, having a hopeful feeling.
Having,
Sometimes we don't.
yes, that's good. Having hope, having something to look forward to, not feeling like when you were diagnosed with MDS, your life was ticking away, like you're just counting your days. So, all right, so we'll get started with that. Thank you for participating, and feel free to ask questions as we go along, and I'll try not to make it too long for you, okay? Well, I got to figure out if I can get the clicker to advance. It's not working. Okay, so it's difficult to define. It's one of those abstract concepts. So how do you measure something that there's not like a number you can put on it? And it's very subjective. What's quality of life to one person is not the same to another person. And we do know that it encompasses more than one part of your life. Like there's functional parts of quality of life, and social and health-related quality of life, and that's impacted by illness. And it can change with time. So this is the definition that the World Health Organization gave to quality of life. Individuals' perception of their position in life in the context of the culture and your value systems in which they live in relation to your goals, like playing all of your rounds of golf, or being able to participate in your family activities without having to leave early, and your expectations, standards, and concerns. So how do we measure it? investigators got together and they interviewed patients, and then they coded what the patient said in the interviews, and then they come up with numbers. And so we do have tools, but for MDS patients, we have limited data, and in order for us to improve quality of life for individuals with MDS, we have to really know more about it. And that's where we really have to ask the patients and their caregivers, what is quality of life for you? And most of the information we have are from clinical trials where they were trying to see if they don't have the survival data, if they can show that the treatment improved their quality of life. And that's where most of our information has come so far. So one of the most commonly used tools is the QLQ C30, and it's called the C30 because there's 30 questions. And they look at physical role, cognitive, emotional, and social, and then they also look at symptoms that really impact quality of life. And fatigue is the most common one that impacts quality of life for patients with myelodysplastic syndrome. And you all told us that. That's how we know. And also pain. You know, if you're hurting all the time, it's hard to have a good time because all you can think about is your pain. And nausea and vomiting. And this is what it looks like when you say, how do you measure it? Has anyone seen this before or filled out any quality of life instruments? There's many instruments, but this is the one that's most commonly used. And you can see it's scored from 1 to 4, not at all to very much. And it's looking at things you would normally do in a day or within your week, like carrying the first one. Do you have any trouble doing strenuous activities like carrying a heavy shopping bag or a suitcase? And then this one's a little more difficult to read. Have you had pain? Do you need to rest? Have you felt weak? Appetite? And you score those. And then there's some more. Do you have diarrhea? Are you tired? And you really can't see that. Sorry. It's the very last one is how would you rate your overall quality of your life during the past week? And then those get scored. And for studies with MDS using the QLQ-C30, I picked out 2 of the trials that showed where the treatments actually impacted on the patient's quality of life, not just their survival, because you want to know that you're going to live longer but not have a lot of pain and be miserable in the process. So one of them was looking at the efficacy of azacitidine plus best supportive care versus supportive care just by itself in 191 patients. And what they found was there was improved fatigue, shortness of breath, and functioning. So the patient was able to do the things that they like to do, and those other symptoms that went with their disease also improved. And that's in a study in the Journal of Clinical Oncology. And then another one with decitabine. You heard us talk about both of those agents today over and over. And this was also a randomized study comparing best supportive care with or without decitabine in 170 patients. And you can see that this also was reported to improve their quality of life. And then how is quality of life affected by transplant? And really with time, the majority, this was not a randomized trial, but it was like looking at all the different studies with transplant patients and trying to pull together what they said about their quality of life. And the majority of the studies suggested that they had a greater than 60% of their patients reporting that their quality of life was rated as good to excellent 1 to 4 years post-transplant. But that's 1 to 4 years, and that 25% of the patients had ongoing problems with medical problems like graft versus host disease and other things. So these are the type of issues that patients with MDS report as far as their quality of life: decreased strength, organ function, altered immune response, other illnesses, the asthenia or fatigue, and other health conditions that worsened, such as like the congestive heart failure. If you get lots of transfusions of packed red blood cells, that can cause problems for you. And then these are the shortness of breath and bone pain. And then altered role function. How many people have had problems with their change in what they're able to do within their family based on once they were diagnosed with MDS? Yeah, some problems with that. And then social issues, transportation challenges, getting back and forth to the facilities to get your transfusions or to meet with the doctor, or having fevers, altered support from your family and friends, the economic challenges, and alteration in sexuality. So those are all issues that don't get discussed all the time when you go to see the doctor. So what can we do about those? And then the emotional issues, the anxiety and loneliness. Uncertainty is one of the big issues with myelodysplastic syndrome, because there's so much that we don't know. Like for an individual, how you're going to respond to the treatment and what your life is going to be like. And these are more depression and communication with your healthcare team. They have noted that patients have reported that they have to try to explain to their other doctors that they see what myelodysplastic syndrome is. It's not like saying I have hypertension or I have breast cancer. You know, even like your primary care physician, trying to get them to understand what your disease is. So that has come out as a real issue. And then trying to communicate with your healthcare team, like getting through on the line how to express your needs and get your needs met. And this is, again, functional issues, fatigue, so much that you can't, like, the kind of fatigue they talk about is like when you take a nap, it doesn't really help you. You're still so fatigued that you can't get your normal activities completed. Is anybody having real issues with that? How many people? Yes. And what do you do for your fatigue?
Go back to bed.
You go back to bed. Anybody else?
Don takes another nap for about 2 or 3 hours.
Another nap for 2 or 3 hours?
What else is there you can do
Yeah.
other than rest? Is there something else that we could do?
There are other things you can do for fatigue. And there's various information that's being put together that's going to be accessible on the MDS Foundation website for recommendations for what to do for fatigue. But what you want to do is look at how you're sleeping. Are you depressed? Are there, what are all the other things in your life that you're doing that you could maximize to improve your fatigue? Your hydration, your eating, how are you sleeping? Many patients who have MDS have a hard time, they have altered sleep patterns. So you know that's going to impact on your fatigue. Some of it you can't change, but you just have to try to do the most that you can do to improve it.
Do you think they're better off not taking the nap?
I'm going to go over that a little bit. She asked about the naps and how those impact on fatigue. If you take too much of a nap, it interferes with your normal sleep cycle, exactly. So, and diminished independence, you spoke to that when you said that's what quality of life means for you, because you want to be able to do things independently. If you have to always call someone to take you somewhere because you're afraid you'll poop out while you're there, then that is a negative for you. So, and missed work. Some patients are able to continue working, some are not. So you do what you can do. And spiritual issues. For some individuals with MDS, it hasn't been all negative. Like they had to reprioritize things in their lives and realize that your relationships with other people take on a different meaning, and it gets redefined for you. Enhanced faith and beliefs, like where are you going with this, and what do you really believe in? It gets to your heart. Some patients have hopelessness and abandonment and loss of self. And then the search for balance. How do I balance out the good and the bad in my life to try to... It's hard to put on a happy face every day if you don't really feel happy, you know?
All you have to do is look around and see somebody worse and makes you feel better.
That's right. That's a very good point. Otto was saying all you have to do is look around and find someone else, and you can...
In other words, they're worse than I am.
Right. There's other people worse than you are, and then you know... And also reaching out to other people.
Talking with them.
Right. And you've done that a lot, helping other MDS patients. And really the only way we're going to improve quality of life for patients with MDS is if we study it. And like I was showing, the best person to measure your quality of life is you. Another person can't tell you what your quality of life is because it's so individual. So that's where we want to start. So some tips for improved quality of life. There are many studies ongoing that almost all of them show that some form of exercise can improve your quality of life. And to ask people for assistance if you're having problems with ambulating or getting around, to set those things up so that you can be more independent. And also looking at your blood counts, like your hemoglobin. And if you have a special family event planned and you want to have enough energy for that, if your hemoglobin is running borderline, to be able to discuss with your team that you would like to get transfused before that event so that you can have as much energy as you need for that event. So, like I was saying, one of the big issues is fatigue, or the most commonly reported symptom for MDS patients is fatigue. And sleep is a big part of that. 1/3 to 1/2 of all cancer patients have changes in their sleep patterns. And so you want to look at the number of hours, the quality of your sleep, and also the environment. Like you want to make sure that there's not a lot of noise in the room, that your mattress is comfortable, that if you need to take 30 minutes before you go to bed to relax and unwind so that you can really get into that relaxed state to sleep. And keep a regular bedtime and waking hours. And you want to avoid stimulants and caffeine 2 hours before you go to bed. And exercise. I know this is hard. When you're so tired, you can't think of exercising. But if you can set even small goals every day to be active and to get your heart rate up a little bit. And you'll need to work with your doctor to make sure that it's safe for you and that you have a safe environment to work out in. And limit the daytime napping to 30 minutes.
My husband plays 18 holes of golf, sleeps 3 to 4 hours, and then goes sailing. But he can't make it through the day if he doesn't do the 3 hour in between the activities.
If that works for him, then I would, and it sounds like he's having a good quality of life. You're playing golf and you're sailing. That's pretty awesome.
That doesn't seem like an option. It does not.
Right.
We have company, they usually go home about 9 or 9:30, and he's in bed before the car's out of the driveway. And I say, should I have invited him? He says,
So good time with family and friends, right?
He's done that.
Very good.
And they're done now.
Yeah.
We're still gonna have them open, but you just can't stay too late.
You just have to tell your guests when to leave.
Yeah.
It works.
Yes. All right. And then you also might need help with anxiety. Some patients, a lot of patients have anxiety because there's so much uncertainty with is the drug that they're going to prescribe for me going to be helping me? Am I going to beat the survival curve, or am I going to be ahead or behind it? You know, what does this mean for me? So,
I can go for the caretaker.
and that can go for the caretaker. Good point.
That last one, we don't sleep with the healthcare team. Just us talking, sleeping with the healthcare team. So we don't sleep with the healthcare team.
You don't sleep.
That's the way she read it.
She was saying, don't sleep with the healthcare team, but discuss sleeping with the healthcare team. And then it's a long day. Discuss problem sleeping. Oh, I see what you're saying. Would you like to sleep with me? You want to see how I'm sleeping? You're not that close to your healthcare team? Okay.
You can blush.
You need to change that wording.
Okay. And then, stand up to fatigue. One of the best, we already said this, one of the best strategies is to exercise. Move to improve your fatigue. It improves your quality of life. Even for transplant patients, they have done studies with transplant patients, and when they have activity that's planned in physical therapy, the patients who are assigned to the physical therapy and exercise team had a better scores on quality of life than the patients who didn't exercise. So it seems like it doesn't go together, but it really does help. And you have to take into account your blood counts. You know, if your platelets are 2, that's not the day you want to be doing a lot of exercising. You want to get your platelet transfusion and then do your exercise. And the primary objective, of course, is to get moving, and you can recruit the support of family and friends to be active with you. And these are just tips to stay healthy. Balanced diet, daily activity and exercise, avoiding infections. That's hard when you're neutropenic, but good hand washing, those common sense things. Get enough rest. And then these are MDS resources. And then, so that's all I have to say. Does anybody have anything they want to share?